we meet again. So, Leica, at the last segment, we kind of talked about insulin resistant, and you said you were talking about pre-diabetes. Um, so, could someone have pre-diabetes and not know it?
Definitely. And this is actually a huge problem right now because 9 out of 10 people who have pre-diabetes don't know it. So most people who have it actually do not know it at all. So we really want to be aware if we have it or not so that we can make lifestyle changes and avoid having diabetes, having it progress to diabetes. So yes, definitely.
Like I stated before, I was insulin and resistant, and I was in denial. I don't know why I was in denial, but I just didn't accept it. So just to be aware that if you are insulin resistant, take it serious and start looking into different foods that you can eat and changing your lifestyle. So listeners, that's my soapbox on that. Leica, what other things that can raise a person's blood sugar besides the food? What other things?
Stress is a big one.
Mm-hmm.
If you are stressed, your blood sugars will be higher. Infections, if you have some sort of infection or illness, that can raise it. And then certain medications that people take for different conditions, that could also cause your blood sugar to raise, like steroids. Steroids is a big one that people take for lung conditions, can raise your blood sugar dramatically. So if you are diabetic, really try to incorporate something in your lifestyle that helps to keep you calm and keep your stress at bay. Nothing is worth being stressed out about and compromising your health because it is a big one. Stress is a big one. So take some time out to walk, meditate, prayer, listen to music, whatever you choose to do that helps keep you calm. Count to 10, backwards, whatever. But make sure you're doing it as a daily practice to keep your stress at bay. Another big one that we don't really think about is sleep. When people don't get enough sleep, that also increases our stress. It also increases a hormone in our body called ghrelin, which increases our appetite. That hormone, that's what its job is, just to make you have a larger appetite. And that happens if we don't get enough sleep. That hormone increases.
I'm getting ready to joke. Ghrelin is like gremlin. Gremlin. So if you're not getting enough sleep, your body is producing this ghrelin,
Ghrelin, yes.
which making you want to eat so much.
Right.
And that's not good.
No.
That's not good.
So really try to get in at least 7 hours of sleep a night.
And then that stress, which it's not only a problem with diabetes, with the stress. It's a problem that causes you heart problems and possibly stroke or high blood pressure.
That's true.
So this stress is a culprit. We need to control our stress, and you gave some real good suggestions on how we can control our stress. Drink some tea and relax. Go sit in the room and without any noise and just sit alone. And I think those are some good suggestions as far as how we can combat that stress. Are there times where diabetics need to be concerned about their blood sugars getting too low? And then if you can share with us what is like the normal range of blood sugars.
Sure. So that it's actually very dangerous for the blood sugar to get too low.
Okay.
Your brain needs the glucose and sugar. And obviously without a brain we don't work. So yes, you can get too low. We want to make sure that we're eating every 4 to 6 hours. Like I said, it's ideally to eat 4, but if you have to go longer, try to at least have a snack if you can't have your meal every 4 hours. And even people who are not diabetic, eating that every 4 hours helps to keep their energy levels up. So that's good advice for anybody, diabetic or not. But if you do start to make some changes to your diet, be careful if you're taking medications because your doctor has your medication prescribed to what your blood sugars are now. So if you start to make better lifestyle changes, you are going to have to get your medication adjusted so that you don't have any low blood sugars because they can be dangerous low blood sugars in the short term can be even more deadly than high blood sugars.
Right, and listeners, I think it's important too, even when you're making your lifestyle changes, to take your medicines how you're supposed to, and take your blood sugars and then report to your doctor what your blood sugar is so that he can adjust your medications.
Exactly.
Don't adjust your own medication.
Right, we are not doctors. Yes, that's their job to do. And just to know what a low blood sugar is, a normal is 70, so when you're going below 70 is when you want to be a little bit concerned. And
how might you feel if you're having low blood sugars?
one of the common symptoms is excess sweating, excessive hunger, fainting. We've all heard of people getting lightheaded or passing out when they've had low blood sugar, confusion, nausea, anxiety, blurred vision. Those are all things that could signal, especially the sweating, that you're having a low blood sugar. And of course, you want to make sure you get something with carbohydrates in immediately to help combat that.
So is there something that we should keep close to us if our blood sugars are low? Like is there
Sure.
orange juice? Because I hear people say orange juice or peanut butter
Any
or
juice
something.
is fine. I'm not for sure how orange juice got to be used so commonly, but any juice can get it up. You just want to make sure that you have, something of some substance afterwards, because remember how I talked about how protein keeps it steady. So if you just have a cup of juice, it could continue to drop later. So go ahead and have something sugary quickly, a small amount, and then follow that up by a sandwich or something that has some protein in it to keep you stabilized.
Okay. What should be the goal for blood glucose and sugar levels in people with diabetes?
So each physician normally has target levels for their patients that they want them to stay within. But normally what we want to do is keep the blood sugars as close to a non-diabetic person as possible. So that's going to be before you eat meals between 70 and 130. And then 2 hours after meals would be 180.
So before
Less
meals,
than 180.
Before meals 70 and 130, and then after meals, what was
Less
that
than
again?
180.
Less than 180. Okay.
And that would be when sometimes your doctor will have you check 2 hours after a meal, and then that number should be less than 180.
So before the meals is called fasting. So when the doctor asks us to go get our blood sugar before our meals, that's actually a fasting.
Yes.
And it should be 70 to 130. Okay. Why is it so important to get a tight control in diabetes?
Yes, and we kind of hinted on this on the last segment that we talked about. It's because we want to reduce risk of complications. Study after study shows that if we keep those glucoses closer to a normal range that we just discussed, we can keep those risks away. The risk of, kidney failure, amputations and wounds, blindness, things like that that can be complications of diabetes. We can keep those at bay if we keep our blood sugars closer to normal range.
Okay. We're going to just shift back to exercise. I know in our last segment we spoke about exercise, but for the listeners that weren't tuned in at that time, Leka, what roles does exercise play in diabetes?
So exercise has a similar effect that weight loss has on insulin resistance. It makes the insulin work better to get in those cells, get that glucose and sugar into those cells for energy where it belongs and out of the blood. So it has a similar effect that you get when you do lose weight. But just make sure when you start an exercise regimen, start slow. Start with your nutrition first so that you actually have the energy to do the exercise, and then start with something slow, maybe just walking or stretching, yoga, things like that are not going to put a lot of stress in your body to begin with, and slowly work your way up. It's not a contest.
Right, we're not competing against ourselves. We're trying to make ourselves better.
Exactly.
So, Leka, where should people go for more information if they want to know more about diabetes?
I would call your physician and get a referral to see a dietitian or a certified diabetes educator. That would be a first step if you have not done that before. And then also they can refer you to classes. Most hospitals have some sort of diabetic nutrition class. And then even from there, you can do your own research online. Go to diabetes.org, which is the American Diabetes Association. And then if you have any specific questions about what I've talked about, you can contact me on Facebook, www.facebook.com/Coach Laka. Laka is spelled Laka.
Well, Laka, you have done a wonderful job as always.
Thank you.
You have enlightened us again on diabetes, and we appreciate it. So, listeners, if you have any questions, call us at 314-524-3958, or you may reach Laka on Facebook, Laka, Laka, on Facebook, where you can ask her some questions about diabetes as well. But this concludes our evening. So I hope that this has enlightened you listeners about diabetes. So just tune in next time for our next healthy topic. Next Wednesday at 4:45 p.m. Have a good evening. Thank you.